Thank you so much for being here. Welcome, everyone. I hope that everyone was able to come to the conference. We saw so many familiar faces. We had a very large crowd. It was so much fun. I have a couple quick announcements before we get started. The first one is, let me share my screen. North Los Angeles Regional Center, their self-determination program local volunteer advisory committee is having a training Monday, December 4th. It's virtual, it's on Zoom from 4:30 to 6, and it's going to be learning technology skills to be successful and independent in the self-determination program. So some of the skills that we're going to kind of go over and teach you are like how to sign a DocuSign, or how do you scan on your phone, your iPhone or your Android, and be able to save it and send it to somebody. How do you send a file? How do you download a file? So lots of things that sometimes people assume that you know how to do technology, that maybe people need to learn. And so I think this is going to be a great one. And if you have any questions about technology, it's going to be a good place to go ask if you're having any issues with it. It's going to also be in Spanish with Spanish interpretation. And so we have that. And I am going to put the link here for registration in the chat in one moment. The other thing that we have is that if you were not able to make it to our conference last Friday, we had 16 panels and breakout rooms, as well as an opening panel and a closing panel. And they were all recorded. And so you can purchase the recording to see all of them if you would like. It's $25 and they are pre-ordered now. So you have to give us a little time to get them uploaded. If you already paid to go to the conference, you get these with your conference purchase ticket. You don't have to buy it again. So if you already paid for a ticket, you will get a link. And we're saying about a month, you'll get a link to see all of the panels that maybe you didn't get to see. So I heard a lot of people saying, oh, I went to this one, but I also wanted to hear this one and this one. So that'll give you the chance to see all of the panels. And we will also put the link. If you want to find this is on our main Disability Voices United page. So go to the main page of DVU, and you can see it right here on Find More Information, but I'll also put the link in the chat. So I'm going to stop sharing real quick. How are we doing on the interpretation? Okay, well, I'll just kind of explain what we're going to do as we're waiting so we don't get ahead of ourselves. If you were not at our conference, the final panel was a series of questions, and it was like a game show almost. We came up with, I think there were 18 problems or issues that were around, and this panel of experts had 1 minute to come up with a solution to the problem. And we had a couple people answer in each of the rounds. And what we thought would be really fun to do today is to play a couple of those and then open them up to the community so we can all discuss it. And because we want to hear all of your ideas and your thoughts on some of these issues. So Judy, is it okay to go ahead and play them? Can we start, or do you want to wait just a little bit? Okay. I would love to. Was anybody there who wants to talk about being at the conference? Any experiences that they had that they enjoyed? You're all very quiet today. Oh, Jenny, go ahead. Oh, I love too, because I think that's really so important is finding other people who are having similar situations to you and knowing that you're not alone in this journey. Ah, Valerio, are you able to, can Valerio unmute? Ah, there we go. I'm looking forward to seeing that panel too. I didn't get to sit in any one. We were kind of jumping around to make sure they were all going. So there are a few I'm like, oh, I need to go watch these. I'm really excited to see them. Christina, do you want to go ahead? Oh, that's so great. And the credit 100% goes to Christina, who managed all of our volunteers, and Daniel and Kira, who was like our Huva goddess, who managed everything. So, but thank you so much. We really appreciate the the shout out. Tina,
I thought the best part was the one that if I had a magic wand, that was a lot of fun. And the funniest thing was when Tim did it really, really, really fast.
yes.
That's hilarious.
So we'll explain that Judy had a timer going, which you'll see in a second in the video, and only gave us a minute. So Tim, on his first one, sped up his speaking. So it was like, and he got in his minute. He was not messing around. The interpretation is working. So please do go down to the globe and select your language. Again, if you speak English, make sure you select English as well, because you won't hear any questions translated. So we're going to go ahead. I'm going to play. So it's perfect that Tina just brought up the panel that it was the closing panel, and it was talking about if I had a magic wand, what would I do to fix self-determination? So we had a bunch of different questions. So I'm going to play just a clip of one, and you'll see the answers from two different people. We might have to introduce them afterwards because their introduction might have been earlier on in the presentation of who they were. And then we're going to open it up to all of you to extend this conversation even farther. So yeah, I'm going to share my screen here. Hopefully this is going to work. Let's give this a try.
Don't forget to share sound.
Okay.
We have this issue. I have concerns about the FMS employer burden rates. They are different at each FMS. Some FMSs are changing the rates in the middle of the year, which will make me run out of money. Some are charging fees for purchases. And so to respond to those concerns, we are going right back to Jason. Go ahead, Jason, from Mainsail FMS. Go ahead, Jason.
Yes, the employer burden is confusing. There's a lot of disparities on what it includes, what the rates are for different FMSs, and it is complicated, and it shouldn't be. I think if I were to wave a magic wand, it would definitely be that there would be some standard guidance, going back to what Victor was saying, and I'm sure he will say, standardization about what's allowed to be in that employer burden, what should be a part of that employer burden, and what should not be a part of it. So it's clear for everyone, so that you know what you're working with in your spending plans. And so FMSs know what the standards are for us as well. And so then we can account for all of our costs appropriately. I think it can be a lot simpler.
Thank you so much, Jason. Let me turn off that. If this shows anything, it shows you can say a lot in a minute or less. If that's all we accomplish in this session. Answering the same question is Victor Lira from Aviana Healthcare. Go ahead, Victor.
Yeah, thanks, Judy. Just like Jason was saying, he knew it was coming. Yeah, I would put rules around how and when FMSs can change the rates, or even ask for a budget increase to cover, unknown costs or forthcoming costs, and define what's allowable in the burden calculation. So, because when you get the absence of structure, then you get variation on policy, and then that can create tension and mistrust potentially. We don't want that. We want this to be able to thrive. So, for example, if the cost of workers' comp was to go up at the end of a calendar year, right? We don't really know what the cost is going to be until we get there. We don't have crystal balls. Perhaps the FMS could appeal to the regional center to increase the amount of funds needed to cover just that increase, so that if a person has a $50,000, in an anticipated payroll expenses, an increase of a 0.05%, not even a 0.5%, but 0.05% on the workers' comp would be about $250, for instance. So depending on what it is, it may or may not be a significant amount of money, but we need to put structure in place to be able to address all of those things and make sure FMSs know exactly what is included in the burden.
Wonderful.
So I'm guessing that there are probably lots of comments about employer burden because we get so many questions. So if anybody wants to raise their hand to talk about employer burden, or what you heard two of the FMSs discussing in this.
Well, I just want to say one quick thing before we take comments, that I heard what Victor said about it's like $250 a year, which sounds like not a lot, but I calculated in my own son's budget how much more he would need with the increase of employer burden rate from a different FMS, and it was an additional $20,000 would need to be added to his budget, and all of that $20,000 would go to the FMS, not to more services for my son, not even to the government for taxes, because the taxes were already in there. And so, I have really significant concerns when it is that kind of money that needs to be added to a person's budget. I see Tina's hand.
Tina, yes.
Yeah. I don't understand what the employer burden actually is, what it's for, and I should understand this because I've been in the SDP for a really long time, but employer burden is a new thing that I never really got exposed to before. So what are they charging for?
We've asked that question a lot. You know, I think that each FMS has a slightly different answer. And I just heard the last week another 1 or 2 FMSs increase their employer burden rates. And so in the real world, the non-SDP world, employer burden generally only means the taxes that the employer has to pay. So if, for those of you who have regular jobs, you know, you have to get income tax taken out of your paycheck. You also have certain other kinds of taxes like Social Security and Medicare that need to be pulled out of your paycheck. Well, when you have a traditional employer, meaning not self-employed or something, that employer shares half of that employer burden rate. So if it's a 12% rate of your taxes that are going to Social Security and Medicare, then 6% of that, and 6% points are paid for by your employer. In the SDP, the employer burden rate is now meaning much more than that. It is also meaning liability insurance, workers' compensation insurance, and other kinds of things, like some of them are saying for the as criminal background checks, that, by the way, the FMS is not supposed to be taking out of your budget. It's very clear in the law. It's not supposed to be in there. And the employee is actually supposed to pay for it themselves. So there's all kinds of things that are in there that are actually supposed to be paid for as the cost of doing business. Remember that the FMSs are getting more than just this percentage from each person's budget. They're also getting a monthly fee from the regional center, as sometimes as high as like $900 per month, to do the business of paying people's bills. And they also claim that some of it's for these bonds that they have to get for each employee, but that's the cost of doing business. So this is all new information to those of us who've been working in this issue for many, many decades. For like Tina, I mean, it is really impacting a lot of people's budgets in a way that really could leave people running out of money before their end of their year, and therefore losing staff, which of course creates a health and safety risk for that person. So that's what they claim it is, Tina. It is, to me, it's not it's not reasonable. So I'm talking about the sole employer model. In the sole employer model, the employee can provide, not the employer, sorry, meaning the SDP participant can provide liability insurance and workers' compensation insurance through their homeowners insurance. And so that's what we try to do, but now we're double dipping, because the FMS is charging us to do the same thing that we are paying for privately through our homeowners insurance. So it's very frustrating, and DDS really needs to come in and fix these problems.
And I think it's also important to know that it's inconsistent across the 11 FMSs. They all have different rules of how they're doing it and what is included in it, what isn't included in it. So I think that it was nice for me to hear that the FMSs are saying, we want guidance on this. You know, tell us what can and cannot be in it. And I think that was a great thought from both of them. Delphina. Oh, Delphina, are you able to unmute? There we go.
Hi, good evening. I just came in because I received the notice late, and so I don't know if my question's been answered or not with your responses, but my question is this. Let's say my valid is for 100,000, and the FMS, let's say, charges me 25%, which would be 25,000. So then that is reduced from my ballot. Is that the way that works? Is that how I understood it?
No, the employer burden is not for your overall amount. It's only for employee hours. So let's say you have an employee and you pay them $20 an hour, whatever percentage they give you. So they'll say, let's say they say it's 20% employer burden, then you would add 20% to that $20 an hour. So it'd be $22 an hour. So that's what you need to then calculate all of that person's hours at that $22 an hour rate. So it's not of the whole thing, just the hours a person works. Now there's a little caveat to that is some of the the financial management services are charging a 1% and charge for things that are not employer. So it would be for any sort of purchase that you're continually purchasing items that then they would charge an extra 1%. So that's the only time it wouldn't be tied to that, how many hours an employee is working. Does that make sense?
So that extra 1% can be for things that you order, like let's say you are ordering exercise equipment or durable healthcare equipment, medical equipment. It could also be a class that you take. So they're just going to take 1% of having to pay a bill for a class. Obviously, 1% of $100, that's like no big deal. But if you are spending a lot more than that and you did not account that in your budget, you will run out of money earlier than the end of the year. So it's really, to me, there needs to be clear direction provided, or else a lot of individuals are going to be in crisis in the near future.
Christina.
Thanks. This is going to sound like a profoundly basic question, but it boggles my mind. How is this possible? And it's a serious question.
Yeah.
FMSs should be essentially regulated entities, right, under DDS. And the regulations should be clear about what can and cannot be charged by an FMS. And when a spending plan is done, there are line items in there, and those line items don't include random fees that an FMS just decides to throw in there, like 1% to buy gym equipment or whatever. How is this even legally possible? And it is a genuine question. And I guess part B of that is, to the extent that the regulations are just so poorly written that this is a loophole, how do we get it changed? And what can I do? I will stand shoulder to shoulder with you. I will go to DDS. I will go to the state. I will fight for this. Let me know what I can do, because I find it horrifically ridiculous.
I agree with everything that you said, and you actually set us up perfectly for our next quote. And so I think that we'll play that because I'd like you to hear what Susie Rayquarth and Jason Berquist said, kind of similar to that question. So let me share my screen again, and let's listen to this one and see. Okay.
Moving on to round number 10. There is too much inconsistency among the FMSs. Some require a vendorization process, which is discouraging non-traditional providers from getting involved in the SDP. Some don't pay for classes up front. Some don't offer credit card purchases. None of that, few of them, I now know that there are a few, provide reimbursements. Our first respondent for that question is Susie Rayquarth from DDS.
Thank you, Judy. So self-determination is unique right now in that the one required vendor actually doesn't have formal regulations, since SDP is a new program. And that's very different from other providers in the traditional service system that have pretty extensive regulations. And that's part of the job of the department moving forward, is to initiate that regulation process. But in the meantime, we are putting together standards to guide the FMSs. And I sure hope that that's a magic wand for some of these issues that are coming up. We're certainly listening to what people are experiencing and talking to the FMS providers about where they may be experiencing some confusion, so that when we do get these standards out for the FMS providers, that they actually tackle the things that need to be tackled and help provide that consistency that we're not always seeing right now.
Thank you so much. I agree. Hold on, let me turn that off. Okay. Our next respondent for that question about the FMSs is an FMS himself. That is Jason Bergquist from Mainsail.
I wholeheartedly agree with what Susie has said. Goes back to the standardization that we've been talking about. We like standards. We like to know what the rules are. There will always be differences in how businesses operate, but some of the discrepancies in how we pay vendors, how we set up vendors, are because there's vagueness in some of the rules, and we're trying to protect ourselves so that we don't have to pay money back, or so that we can make sure we're following policies if we're audited. And so I think any standardization is key. I also think education is important. Goes back to the questions earlier about orientation and training, not just in the SDP orientation, but in how we as FMSs orient, that we have really good standards for how we do that and share resources together. We're as FMSs, we're competitors, but we talk to each other a lot, and we share resources about what works, what doesn't. And I think coming together and doing that will really help us standardize what we're doing and provide better services for everyone.
So I think that kind of hit on what Christina was talking about. Why are we where we're at today? FMSs are not regulated yet, I think is probably the answer to that question. Tim has his hand up.
I just had a great idea, because this is how my mind works. With regarding employee burden, what if we find out what is the employee burdens at like a McDonald's? Because I'm assuming that all McDonald's have the same burdens for all of their workers in all of their restaurants. DDS could give some kind of guidance for all FMS that want to do business in California. They have to use the same workman comp policy so that the rates are going to be the same from the 11 FMS. Right now, they all have different rates because they all have different policy.
I agree, Tim. Let's put Tim in charge. So there are standard for the tax part. You can look them up and they say, this is the rate for each tax pieces. The problem we're having are the other things they're including, and what some are including and what some aren't including. There's always going to be a little bit of variation in the employer burden with how much, if you're in co-employer, especially what their workers' comp costs, because that'll be dependent on the financial management service. So whatever theirs cost might vary. So we expect it to have a little bit of variance, but these really significant differences, I don't think should exist.
Yeah, and I have to say that they really don't exist this way in the traditional system. So in the traditional system, vendors now, it wasn't always like this, but there was a rate study because there was wildly different rates that vendors were receiving depending on the deal they got with the regional center. Some vendors were being paid very low rates and were having a hard time staying open, and other vendors were getting sweetheart deals with really high rates. Well, the days of that are pretty much over, at least in the next few years. That will be gone, and the traditional vendors are very highly regulated. however, their business practices internally, they have much more flexibility on and how they pay their employees and how they run their businesses. The difference between the traditional system and the SDP is that the way that the FMSs are choosing to run their business has a direct impact on us, the SDP participants and families. And so if they choose to pay their employees less or more, or they choose to hire in certain ways and as opposed to other ways, that doesn't directly impact us. What impacts us is when you're taking money out of our budget that is supposed to go to services and supports for us. And so, I really hope, and I encourage all of you who have concerns about your FMSs to reach out to the ombudsperson's office. I'm not going to say that they're going to do anything about it because maybe they don't have the power, or maybe they just don't really help as much as we'd like them to, but they do keep data on how many people call. So if 100 people call, that makes a big difference. The second thing I would do is to write to Susie Rickworth. The more she hears from people, the more she realizes this is a crisis and they need to get involved. And then the final suggestion is for you to go to your local advisory committee meetings at your regional center and to, during public comment, make a complaint about this to your advisory committee. Their job is to make recommendations to the regional center and to DDS on how to improve the program. And so having a bunch of local advisory committees writing a letter to DDS about this also has a great impact. So I encourage you all to speak out, because Christiana and I have been saying it, but we're just two people, and so the more people who do it, the better.
I mean, we're loud people, but I don't think we're loud enough.
Yeah.
And the other thing that I do want to say is that, we have to be partners with our financial management services, and we want to be on the same page. And so we need to work together. And I want to say that I don't have a problem with any of the FMSs with their 1% or their 2.19%. If these are administrative costs and they need to be paid, I don't agree with them asking the participants to pay it. That's really where I'm concerned. It's not that they don't need those paid or whatever. They should be negotiating that with the regional center who pays their administrative costs. That's where my concern comes. It shouldn't be taking away a service in self-determination to pay that piece. Rosie, you've been very patient.
Before you go to Rosie, could someone on staff, oh, there we go. Kira, if you could also put the link to the SDP ombudsperson's page on the DDS website, that would also be great. Thank you.
Oh, awesome.
It's in
Rosie.
there. Yay, good job.
Oh, is Rosie able to unmute?
All right, move on to Beth.
Yeah. Maybe Rosie will come back to you if you can hear us. Beth, can you unmute?
Yes, I can. Thank you all for a wonderful conference yet again. I can't wait to hear all the recordings. I have a recommendation for you guys on this FMS burden rate, and that is, it sounds like the community is all of pretty much of a like mind. It would be ever so awesome if DVU could put out a policy statement, and then all of the community can write to Susie and say, yeah, what she said. Rather than us coming, it'll make it easier for DDS because they'll get a consistent viewpoint, and it'll make it easier for us to not mess up our explanation of it. So that's my suggestion.
We're happy to do that. We'll come out with stuff like that. And
yeah, I think that'd be great.
So Beth, you should also know that DVU, us, we're looking to introduce some legislation to fix the self-determination program for next year. We'll be coming back to all of you repeatedly to get you to sign on to that legislation. and to show up to hearings and write letters to your legislators about it. So
Yeah, absolutely. But in the meantime, I think 2,000 people would be more than happy to tell Susie that that 1% at least is bullshit.
yeah, great.
Thank you.
Thanks, Beth. Rosie, I'm sorry for skipping you. Can you unmute now? She unmuted right when Beth did, and then we lost her.
Oh, there she is. Okay, great.
Hi, I apologize. And good afternoon. So, I wanted to make a suggestion. I'm listening to all of the parents at this time, and I do believe that it is absurd that DDS is paying the regional center to basically surveil the parents that are either in SCTP or about to do the transition. Why not make the petition to DDS so that instead of doing that, they actually assist with the FMSs so that they are more accessible, or that, they pay for that percentage that we're supposed to discount, or that is discounted from the regional center clients.
I agree with you, Rosie. That I think we're definitely all on the same page, which is we all celebrated when our financial management services had that rate increase because it was very low, and we couldn't figure out how they could survive on the very low. So it's not that we don't want to support our FMSs, but they are a vendored service, and they have to follow the how vendor services work. And I'll tell you, if a regional center with any other vendored service, if that vendored service just out of the blue decided to start charging the participants some amount, the regional center wouldn't permit it. So we're really not exactly sure how it's happening here. So some of it is the regional.
My question is, why does that need to be removed from the budget for the consumer? Because like, okay, let's say that I'm doing the transition to self-determination because that is the best choice for my child. But from there on, they're going to take away $50,000 to pay the FMS. And that's ridiculous because at the end of the day, I am doing the transition to help my son. But there is a part of that that's going to the agency, and that is not okay. If this law exists, it should protect the consumer as well, because supposedly there is a budget, and this is targeted for the consumer, and that percentage is too much. They're charging 25%, and it's going to increase the next year, and that is not fair for regional center consumers.
So I'll tell you, some of the employer burden will never go away, because that is kind of the part of being an employer, that we'll have to pay that. But there were parts of that employer burden that, so if you had like a respite worker from the traditional system, and they were coming to your house, and that respite agency would be paying that employer burden to that person. So because we became the employer, we're like the agency, that's why we have to pay that percentage. But you're right, Rosie, we have to be very careful and very protective of the spending plan, and that the spending plan monies are being spent on services that further our loved ones' needs and our needs if you're a self-advocate. So I agree with you, Rosie.
Quote unquote, it improves, but the percentage, it's too high what agencies are charging. And that is what I'm talking about. What the agencies are doing is not fair. That percentage should be reduced instead of increased, because it is based on the needs that they have on the traditional system. It's nothing new. It's something that already exists in the traditional system. But now, as parents, we're trying to help our children. And the regional center is not supporting our children adequately based on the needs. So that's why the best path forward is self-determination. And by doing this, they're tying our hands, so to speak.
I have the next clip, which is round 3, Judy. We ready for the next one? Let me share my screen. Here we go.
Prepared for this. Round 3. My regional center service coordinator doesn't understand the self-determination program. They told me I am not eligible, or they discouraged me from going into the program. Regional center staff need more training. And I realized just a second that I forgot to introduce Rick and Tim before you spoke. Let me just go back and do that. Tim Jin works for DVU as our Director of Empowerment Programs and is a self-determination program participant. Rick Wood is the chair of the Kern Regional Center Local Advisory Committee, as well as the co-chair of the statewide Self-Determination Advisory Committee, and is the parent of a pilot participant for over 25 years. I now would like to introduce Mitchie Gates, the Executive Director of Kern Regional Center, who will answer this issue about regional center staff needing more training. Thank you so much for joining us, Mitchie.
Thank you. Are you starting my time? Okay. So I would start the self-determination plan program training immediately for new staff at new employee orientation. The NEO would include self-determination success stories like Rick's, so that service coordinators could see right off the bat how impactful this program is and can be. And then we would continue with more in-depth training and refresher training at the unit levels within the regional centers using the participant choice specialists. We would require passing a competency test on SDP through an online training module. We would have weekly participant choice specialist consultations available. IPP approval form would include whether or not the SDP was discussed, and there would be a survey after the IPP.
Those are phenomenal ideas. I love it. I love it. Okay, great. I just want to do a quick note to Tim. I will not cut you off. If you could slow down your voice output, the interpreters could not interpret that. So I really appreciate it. I will give you extra time. Okay, our next speaker on that same issue is Will Liner. Will is the managing attorney for the IBD practice group at Disability Rights California. Go for it, Will.
Thanks, Judy. Regional center training, that's a good thing. I think we can all agree with that. But it's not enough by itself. So I would also make, and I think Michi said this, SDP discussions part of a standardized IPP process so that everyone's getting all the information about their options at least once a year. But even more broadly, if regional centers are discouraging people from entering into STP, we have to be curious and ask why. Is it because they just don't understand it? Do they see the onboarding process as a headache because it feels too complicated? Are they just too busy serving people in the traditional system? Is it all the above? So if I had a magic wand, I would identify and eliminate all of those barriers that drive service coordinators to steer people away from SDP, remove those barriers, and then incentivize the opposite.
That was a great one, wasn't it, Judy?
I have to say that it's very weird watching myself on the screen while I'm on the screen in a different part, but that's okay.
It's like the clone of you over there speaking.
Very weird.
So I was in a programs and services meeting this morning, and they were talking about June of 2024, there's going to be a standardized IPP template coming out. And I was curious if SDP being discussed is going to be on that template. And if it's not, is there anything we can do as a community to encourage that?
Well, I went to these are public meetings where they discuss the IPP template. So this is the same IPP that everyone, it's kind of like a form that every service coordinator at all 21 regional centers will have to guide the person-centered service planning process. So it's not the same as the SDP person-centered planning, but it's just about the services that regional center provides. And I can tell you that I was at the meeting where they presented the very first draft of that document based on focus groups and lots of meetings with lots of people, and the self-determination program was not even in there. So obviously we had a lot of pushback on that. I have yet to see a second version of that document being floated around, but I can tell you that Disability Voices United had a bill that a lot of you know about, AB 1147, which was put on pause for the last few months, and we're going to reinvigorate it in January. And if that bill ends up passing, that bill requires the self-determination program to be discussed at every annual IPP. So, of course, it doesn't require training of service coordinators on the SDP. But you know what we're trying to make sure is that there's some universal training happening so that every person who works at a regional center understands the program and that everyone is offered the program.
Would it help to have people come to the open meetings? Do they permit people to speak? So we'll make sure to share when that meeting's coming up, I think.
Yeah. So they don't permit people to speak, but they do permit you to write questions in the Q&A in the webinar format. Tim Jin sits on that committee, and there are a few others very involved in the SDP who sit on that committee. So I see a couple questions about this in the chat. Somebody was asking the number of the bill. It's Assembly Bill 1147 or 1147. Jenny was asking, are IPPs required every year or every 3 years? That's a little bit of a complicated question, but IPPs are currently required every 3 years, according to the Lanterman Act. However, the federal government requires person-centered service planning every year. So if a regional center is going every 3 years for an IPP, that to me is breaking the law of the federal government, maybe not the state government. Part of our legislation that has yet to pass is requiring more frequent IPPs in state law to align with what is required federally. But folks should know, Jenny, you should know that even if a regional center says we're only required to do it every 3 years, you have a right in the Lanterman Act to ask for an IPP as often as you want. You can have them more than once a year if you have something that you need to discuss about changing needs or changing, you know, what services you get. So, don't let the regional centers tell you, no, you have 2 more years for another IPP. You don't have to say why you want the IPP. You can just say, we need to discuss the level of services. and they are required within a certain time period. I feel like it's 30 days. I could be wrong, so don't quote me on that, but I think they're required if you formally request and do it in writing, an IPP, they have to meet with you within 30 days.
You're correct. It is 30 days.
Good. Got that.
Carolyn Johnson at 514 said, I missed the conference. Can I ask the regional center to pay for the recordings? If so, please provide instructions. Thank you.
Yeah, so we are a vendor of most regional centers. There are one or two that require us to have an absurd amount of insurance coverage anyway, but most regional centers will pay. You would just need to, you would need to get a reimbursement, because the way that we're doing the payment is you have to use a credit card to pay for the recordings, and you could just, in advance, you could ask for the regional center to reimburse you.
Do it under the same as you would if you were asking for any other training. So you would ask your service coordinator for training, and you can show them the website, what you're interested in. And so yeah, don't purchase it before they give you the okay, because they won't guarantee after the fact. So make sure you get the clearance first. So Mari, how are you? Hey.
Mari, a box specifically to talk about the self-determination program, is that what you mean? So there is no statewide form. Each regional center has a different way that they do the IPP. And so definitely there's no box. I guess it's possible, since I haven't seen the IPP at all 21 regional centers, that some regional centers do have that requirement to talk about it. So I'm not positive. So it looks, Beth is saying that there is a box at Regional Center of Orange County, new this year. So that's great. That's great news. It's not a statewide requirement though. Nothing. No. That's why we're trying to get AB 1147 passed. Yeah, I mean, it's really about spreading the word. I mean, this is why we exist here at SDP Connect, and why so many other groups are talking about the self-determination program. I think that there are a lot of places we need to tell people. It's at schools, at children's hospital, and health clinics, that we tell people about the self-determination program, because we can't guarantee at this point that they're going to find out about it from their service coordinator.
Us too, Mari. It's frustrating for um Judy, Griselda Estrada at 506 said, ombudsman question mark. I need info. Can you explain? And since we just found out that it changed a little bit, maybe you could explain who and what an ombudsperson is.
Yeah, so Kira did put contact information about the ombudsperson's office in the chat. So it's a terrible word, ombudsperson. It's usually called ombudsman, which is very male oriented and sexist, but the ombudsperson, it's a term that exists in government throughout the country. Thank you, Kira, for putting it in again. An ombudsperson is basically a person assigned to a government agency to help individuals who interact with that government agency to get their problems resolved. So if any of you get IHSS out there in home support services, they have their own ombudsperson. And DVU got a law passed a couple of years ago creating an ombudsperson for the self-determination program. And they took a very long time to appoint a permanent person, and they appointed a woman named Susie Requarth, who is running the self-determination program at San Diego Regional Center. She held that position for a number of months, not even a year, and then was given a different job at DDS to run the self-determination program from internally, not to resolve problems, but to actually run the program. And to this day, it has been almost a year. To this day, they have not replaced Susie with a permanent ombudsperson. It's really quite irritating to me. In the meantime, DDS also created a general ombudsperson for the entire DDS, for the traditional system, basically. And that person was just appointed in the last few weeks as a permanent person, and that is Katie Hornberger. So Katie has been the person who has been serving as the temporary SDP ombudsperson and is now the DDS ombudsperson. And we're still waiting for them to appoint the SDP ombudsperson. All right. And their job is to investigate complaints when you call them up. You can call them, you can fill out a form on their website. I think you can also email them. And so they're supposed to investigate complaints. They're supposed to help resolve conflicts between participants' families and their regional center. And they're supposed to make recommendations to DDS about policies that should be put in place when there's problems they're seeing around the state. So, we had big hopes and dreams for the ombudsperson's office, and they are not yet realized. So we are hoping that will happen at some point in the future.
So Judy, with the new DDS ombudsperson, if we're having a problem with the traditional side, could we contact
Yes.
the new?
Yeah. So
who is still our same person
yes.
we were talking to before.
So I will go to the DDS website and find the link for the general DDS ombudsperson, Katie Hornberger. You can file a complaint. Like, let's say you're not yet in the SDP and you're having issues in the traditional system. But if you're having problems transitioning into the SDP, you should use the SDP ombudsperson's office. Or if you went to the general one, they would probably refer you to the SDP office. I will find that link for you.
Good to know. Good to know. Mina Tadameti at 524 said, if they make an addendum to the existing IPP, does the new IPP date begin from the point, or is it the original date? That's a great question, Mina, and it's the original date. So your IPP, when you have your full IPP meeting and you sign that document, that will be the date. That's the date that it's going to be. That's going to be your annual date. If you do anything in between, they call it an addendum, and it's just one sheet, and it's just adding on to. So it does stay with the original date. So I thought that was a quick, easy one we could answer. Consuelo. Consuelo, are you able to unmute? Well, I'll come back to you in case you're having problems unmuting. Virginia, are you able to unmute?
Yes.
Go ahead.
So going back to, sorry, a couple of topics ago, is you're talking about like self-advocacy training, or I believe like even parent training to assist the client at regional. I just requested something and it was declined because they said that it was not for my son. And so, and it was like training for me to help him, like it was like more IF training to help him in his SDP process. And I was just kind of curious, like, how does it delineate between like parent training to help him versus like he has to do it himself to qualify for, you know, reimbursement from regional? Sorry, this is on, I'm just in the middle, so I'm just pre-traditional. So we're gonna go live like next month. So just to kind of clarify the sort of how the funding is. But I would think though it would be paid in either, doesn't matter if it's traditional or SDP, but I don't know if there's a difference. I hope that makes sense.
It definitely makes sense. So there is parent training in the traditional system. So it does not need to be your son getting training, that you can request parent training. Now, there is a specific thing in the law that says if you are an independent facilitator, you have to pay for your own training. So I have seen that regional centers who will say they won't pay for IF training because of that. Now, I think you have a good argument. I'm not going to be a professional IF. I'm just doing this to help my son. Sometimes some of the regional centers you can argue it through, and some of them, they just won't let you. So, and I'm curious if there are any other IFs on this group, because I know there are, if they've had experience with that, with regional centers just not paying for IF training. So it could be the one that you're asking for. So I have another clip that I was going to play. I put it up here. It's round 4, Judy. So I'll go ahead and play this.
Regional centers are very inconsistent in the way they are implementing the SDP. We have 3 respondents for this particular problem. And our first run is Susie Reporth. Susie is the Assistant Deputy Director for HCBS and SDP branch, and at the Department of Developmental Services at DDS. Thank you, Susie.
Thanks, Judy. So 21 different regional centers means local variation, which is really good for such a diverse state, but as we all know, it presents challenges with a program like self-determination that largely shares the same vendor providers like financial management services. And in many cases, the independent facilitators throughout the state are working with multiple regional centers as well. So from the department side, we get a lot of feedback that standardization would be helpful in specific areas. Oftentimes people will tell us, can you put some standardization in place around the spending plan, around the individual budget, around HCBS compliance assessments? And so if I had my magic wand, I would like to make that standardization work for people, and that's going to require a lot of community feedback. But I also want to preserve the local variation that makes sense, like with the implementation funds and how those are used.
Thank you. That was really helpful. All right, our second, we're going back to Mitchie Gates from Kern Regional Center. Go ahead, Mitchie, after you are spotlighted. There we go.
Okay, I'm ready. So our regional centers, through their discipline groups and their Association of Regional Center Agencies, would look at the differences in the way each of us is implementing across our centers, and then we would look at some best practice standard processes, and the development would also need to include, obviously, input from individuals and families about their observation of what the differences are, what's working, what's not working, what they would consider best practices. And then regional centers could learn from each other about what's best practice. And then through our association, we could develop a standardized process that would work for all of the 21 regional centers, taking into account some of the local differences that would be needed, but overall that we would be using that same standardized process, which would be super helpful, I think, for regional centers as well.
Thank you. That's a great perspective to hear that regional centers would want that as well. Thank you. Okay, so let's move on to our third respondent on this same issue, Victor Lira. Victor is the president of support services for Aviana Healthcare. Thank you, Victor. Victor is the king of standardization, so we felt we must answer this.
Yeah, so staying with the theme of standardization, I would provide all the regional centers with a standard guide defining the processes. So if I had a magic wand, I'd have a dedicated, highly trained unit at each regional center that included the intake department, service coordination, all the way to the accounting department, so that all of that was intertwined in the communications there between all of those pieces. It would talk about things like standardizing background information and training on SDP. The service coordinators and the regional center staff can get informed on the employee onboarding process of the FMS, community vendor onboarding processes as well. Include things such as reviewing and finalizing spending plans. What does that entail? And then inform the participant about the regulations concerning goods and service purchases, so that there's expectations up front about what may or may not be possible. And then lastly, how to move the funds in the budget correctly and efficiently, so that way we could continue to provide the best possible services we can.
Thank you.
I think this is probably one of the most common things that we have of how come I can get this at my regional center and somebody 5 blocks away can't get the same thing. And I thought that it was such an interesting opportunity to get DDS, a regional center, and an FMS's opinion, all in just a couple minutes here on the idea of standardization. They didn't really disagree, and I think that was the thing that really blew me away on a lot of these things. That nobody's saying we don't need standards and we don't need best practices. It just isn't getting done. So that's the next step. So we can all agree we need them. And so that now the next one is, but how do we achieve this? So. Judy, did you have any other comments about the standardizing?
Well, this is an issue on this is a problem on every part of regional centers, that whether you're in the traditional system, whether you're getting an IPP, there's the kinds of services that you get to receive are different depending on your regional center. And we have been calling for there to be more clear guidance by DDS to ensure that people are getting the kind of, that you don't have to live on one side of the street versus the other to be able to get services. So this is nothing new. There was a whole Little Hoover Commission, 4 hearings on this exact issue, which I encourage you to go to Little Hoover Commission and look up the hearing on this. I'll try to find that and put it in the chat. But this is nothing new.
Yeah. Well, and I understand there has to be a balance, right? Because when you over standardize, you lose individual. And so the finding the things that should be standardized and the things that should be where people have freedom of choice. And that's the trick that is always there to what needs to be standardized and what should not be. Otherwise, we won't have self-determination program, because if they tell us what's the standard program you can have, then we're kind of back to traditional system. So, but I absolutely think that there are things that could simplify this program to the point where people can easily transition in and they can easily run their programs. And that's where I really want to see these things happen. There was a question by Lynn Tong at 5:35. I have a question regarding IF, independent facilitator. I had a very difficult time finding one who wanted to work with me and the regional center. Many asked for cash up front. I was told there will be a new law mandating IFs to have some insurance. Therefore, many are leaving this industry because SAM insurance is extremely costly for them. Is this information correct? Should we now learn to be our own IF, or is it common just to pay out of pocket? I'm actually really glad that you brought this up, Lynn. You should not be paying out of pocket. Absolutely do not pay out of pocket for an independent facilitator. If you're transitioning in the traditional system, the regional, between the person-centered plan, which will be paid for non-vendor service under 024, is paid for by the regional center up to $1,000, and self-directed supports under 099 will help with the rest of the transition process. So you should not be paying for assistance to transfer into the self-determination program. I'm concerned about anybody who's asking you for cash up front. I would not. If they ask you for cash up front, say thank you very much and move on. Like we were talking about, the financial management services don't have regulations. The independent facilitators are not regulated. It is something that is on DDS's radar. They need to be regulated. I'm an independent facilitator. I think we need to be regulated. You said the other question was the issue with insurance. And, I talked about the self-directed supports for that transition piece. That is called 099. It is a new vendor type of independent facilitator who's going to help you transition. And they do require insurance. It has been a concern for independent facilitators to get this insurance in order to become vendored with the regional center. This does not impact independent facilitators who help you once you're in the program. So technically now they've kind of changed it. So up to the point where you transition in, first they would be called a person-centered planner. Then they would be called self-directed supports. You're really technically only called an independent facilitator when you're helping people who are in the self-determination program. There is no set rate for independent facilitators. Once you're in the program, you negotiate that with your person that you're working with. It is a good independent facilitator is a professional, and they should have a lot of background in a lot of areas. And that's what you're paying for. And you have a lot of them have very high rates. So also make sure when you're in self-determination that the person you're paying is the right person for the job. That maybe you don't need somebody with extensive advocacy skills to help you go over your budget once a month, or to help you with the hiring of a person. You could have a person who manages your staff. So definitely keep that in mind. And that's my recommendation on independent facilitators.
Can I ask a question, Christiana, because I'm losing my mind?
Mhm.
I was looking for, first of all, I was looking for the HCBS final rule, which requires an annual assessment or an annual review of your services. I finally found exactly what I wanted, and the link is in the chat. Look at the very bottom of that for Jenny, I think was asking. But then I said I would look up another link, and now I can't remember what it was. Do you remember?
Hoover Commission recording.
Thank you.
Thank you.
There are brains. Christina and Kara are our brains.
They are. We would not function without them. Christina, your hand is up. Other Christina.
Hi, thanks. I just wanted to offer another perspective on the IF charging up front. Because I know I had a conversation with an IF who didn't used to do that and then started to do it. And the reason was because she had a massive accounts receivable balance with regional centers because the regional centers were not paying her. So what she did was she said, I'm going to have to start asking for payment up front. And then if I get paid by regional center, return the money to my client, because she could not continue to basically work for free because regional center wasn't paying. So I just wanted to offer that perspective. I don't know if you have ever had that experience, but and this is somebody that I respect. She's not somebody who I would say is trying in any way to game the system or anything like that. So I just wanted to offer that perspective that the entire SDP process and the regional center process is super inefficient and makes it hard for people to do business. It makes it hard for the FMSs to do business, right? They have to pay out first and then get reimbursed, right? So a lot of it is just kind of tough from a cash flow perspective to be in this business.
I agree. I am an independent facilitator. I have outstanding bills for 9-10 months. It's still not okay. We have to, as independent facilitators, we get together and advocate and get paid on time. Absolutely. It is a 100% hardship. I know that, but we cannot be charging people upfront because think of the disparity that creates. That only the people who can front money can get into self-determination program. And it's just not okay. Judy, do you want to add to that?
Yeah. So back when we got the law passed in 2013, we started having meetings in 2014. This issue literally came up at our very first meeting in January of 2014, 3 months after the law was signed by Governor Brown. And we continued to have the conversation for several years. And I remember in 2015, because my father was in the hospital, so I remember this meeting very vividly, that I ran over from the hospital and I sat and we said, Rick Wood was there, Harvey Lapin was there, and we sat there and we said to DDS, FMSs must receive the funding up front because that's the way it was done in the pilot project for 20 years. And that's the way it's got to continue. And you all need to know that the FMSs who were in that room were like, yeah, we're okay. We don't need it. It'll be fine. We can get it. We can get the money, you know, as long as it's done in a timely way, we'll be good. And then, of course, what happened is they didn't get the money in a timely way. I can tell you, I remember GT Independence told me that at one point they were owed over $1 million. From a variety of regional centers, but some in particularly were bad. Aviana told me that they stopped working at certain regional centers because the bills were getting paid so late. And so y'all should know that this is a problem in the traditional system, that service providers are getting paid really late as well. That is a problem that needs to be corrected across the entire DD system. But because there were FMSs who were leaving the state or restricting themselves on which regional centers they would work at, there was a directive put out which requires DDS to pay, which requires regional centers to pay the FMSs every 2 weeks. So that even though they're putting out money, they're getting paid back within 2 weeks, which really for businesses is pretty good. The problem is it's just not happening in every place. And there are some smaller FMSs which can't float that kind of money. So, but the thing is that they're overcorrecting it now by putting in these extra fees, so they're making more money in other ways, because it's all messed up, and the inefficiency of our system is really the culprit of all of these problems.
Oh, well, Tim's typing
Think about individuals like myself who sure self-advocates and have no family support. How can I pay out of pocket to an independent facilitator to get into the program? There is no way a person like myself to get into self-determination if I was obligated to pay up front.
I agree. And that's my concern around it. It is a problem, and Christina is hitting on a problem that does exist, and it's a very real problem for independent facilitators. It's one that, you know, a group of independent facilitators are getting together to try to advocate to kind of get the same thing that FMSs have, the requirement they have to be paid every 2 weeks, saying, can you add independent facilitators that you just need to pay them every 2 weeks? Jenny, your hand is, oh, go ahead.
5 minutes out, so maybe just 1 or 2 more comments.
Okay, Jenny, go ahead.
Thanks, Jenny. So here's my advice. So if you want to go the IHSS route, you can appeal it, and there are actual people that will help you appeal it. The way you get the big amounts of hours is by arguing that your sister would need protective supervision, which it sounds like she might. On the other hand, regional centers are required to fill in when IHSS is refusing to provide the support. And so IHSS, the amount that is paid through IHSS is, you know, just a little bit above minimum wage. But so let's say you have 50 hours of IHSS, and this is an adult we're talking about who needs 24 hours a day of supports. You can fill those extra hours in through funding in the self-determination program, which is going to be a lot more than minimum wage. So I know people who, so my son gets the maximum amount of IHSS hours because he has this, you know, the protective supervision, and his SDP budget is much smaller than his friend who doesn't need 24/7 supervision, but gets very few hours of IHSS. And so he ends up having a much bigger SDP budget. So my suggestion is go the route of regional centers right now, try to get those services in place first from regional center showing that your sister was denied the IHSS hours. And if that fails, then go back and you can actually find an advocate who usually will do it for free and take it. If you succeed, they will take funding from IHSS if they win in the appeal process. All right, looks like Fernando Gomez is going to have the final word today.
Well, we are right at 6 o'clock. And so I want to thank everybody so much for being here. We do not have an SDP Connect at the end of this month because of the holiday. And so we will see you on the 2nd of next month. And we look forward to seeing everybody then. And since we won't see you, have a wonderful Thanksgiving and safe, eat lots of turkey and spend time with your loved ones.